Just when India is fighting the third wave of COVID-19 with a steady decline in cases, we now have to fight a new enemy. Yes, we're talking about the Delta Plus variant, which the government has today come out to say that is present in at least 3 states in India. We're talking about Maharashtra, Kerala and Madhya Pradesh, where the advisory has been issued by the central government. Now, these 3 states have been asked to ensure enhanced tracking, testing in areas where the cases were reported, and it's further stated that Delta Plus has following characteristics: increased transmissibility, stronger binding to the receptor cells of the lung, potential reduction in monoclonal antibody response. Let's take this across to our doctors who are joining us on our panel. We have with us Dr. Rajiv Dasgupta, epidemiologist and member of the National Task Force. Also with us is Dr. Arvinder Singh Soin, chairman of the Liver Transplantation and Regenerative Medicine Department of Medanta. Dr. Soin, this is, of course, a major issue of concern. The government, of course, there was a lot of, a little bit of confusion earlier this evening about whether it's a variant of interest, a variant of concern. There was a lot of back and forth between that. But certainly for India, where at least 3 states have reported this particular strain of Delta Plus, this is a huge area of concern, because experts believe that if there is a third wave, this could be one of the reasons. This strain could be one of the reasons that drives that third wave potentially. How are you looking at it as a medical expert?
Well, at the moment, it's too early to say if Delta Plus will be the reason for the third wave, because we just have very little data. We've only found, I think, 22 cases in 3 states out of 7,500 that were tested. But what's of concern is that, yes, it's thought to be more transmissible. It may escape monoclonal antibodies. It may escape vaccines even. And it attaches more firmly to the lung cells, which basically means it's possibly more virulent. And monoclonal antibodies may not be able to compete with it in terms of attaching it to the lung cells, which means that it can cause more harm than the existing variants. However, I think that the game plan should remain the same, that we should observe COVID-appropriate behavior, not just observe, but enforce as far as the authorities are concerned. And we have to keep on vaccinating at the same speed that's happened over the last 2 days. If we vaccinate everyone with at least 1 dose, and at least 50-60% of the population with 2 doses over the next 4 to 6 months, we can still escape the waves. Whether the wave itself will have the Delta Plus variant, it depends on analysis. Now, the other thing that we must ramp up is genomic analysis, because this is not the last variant. This is not the first variant that's come through. There will be more variants, and whether they are important in causing disease and whether they are more virulent will only be found out if we do genomic sequencing on increasing numbers. And then we correlate on how many people had bad infection with this variant versus the other.
Right. Let me quickly take this across to Dr. Rajiv Dasgupta as well. Dr. Dasgupta, your views on this, because clearly there is a lot that needs to, in fact, come out in terms of research. There's very little data that is currently available, but this is a variant that is also present in several other countries, as today the Health Ministry had shared in the official briefing. Do you think that there is a lot more cooperation that is needed between countries? I'm sure it's already happening, but what more can we learn from this? Because we certainly need to very sharply up our learning curve on this variant if we have to tackle it effectively.
Thank you. First, I completely agree with all that Arvinder said. Absolutely agreed. However, in addition to that, what's going to be very crucial in the days and weeks ahead, that as India opens up, workplace safety vis-a-vis COVID transmission will be of paramount importance. And that's what the experience is in the run-up to the second wave, which was largely spearheaded by the Delta variant. That's something on which we still haven't got adequate regulatory inputs or really COVID-specific practice in terms of building, in terms of ventilation, in terms of airflow, and so on. This is not just offices, but all kinds of indoor workplaces. That's going to be very crucial. Also, as he said, that there isn't still enough information on the spread of Delta variant. It's early enough. The only sort of consistent pattern can be seen in Maharashtra with clusters of cases in the Konkan region as well as in the Pune region, a cluster of districts, but that also perhaps because Maharashtra is testing more for genomic evidence. Other states, wherever it's been found, is sporadic, at least at present. Though the government raised the alert from variant of interest to variant of concern, but that's probably more precautionary than based on evidence at present, at least not from what we know. It seems to be early, but perhaps it's chosen to act safe.
Right. Dr. Soin, if I can also ask you, are there any lessons that we have learned from the past two waves? For instance, genomic sequence is something where there has been a lot of concern about whether we have been fast enough over here in India. And now with this new strain coming in, do you think that that is an important concern? And are we equipped enough to handle that?
Well, I think let me take that in two parts. First of all, the biggest lesson that we ought to have learned, I don't know if you've learned it, is to have our own data. We keep, debating about the gap between doses. We keep talking about whether variants are important or not. And if we have data on who's got vaccinated with 1 or 2 doses and who's got infected, whether they are severe or whether they're getting hospitalized, and what variants they have, we will answer most of the questions going forward. In the sense that if we have data over the next 2 months, we will know what to do over the subsequent 3 or 4 months. The other thing that I wanted to point out here is that mRNA vaccines tend to be very good with variants because it's possible to tweak their manufacturing process quite quickly and actually get mRNA vaccines ready for variants. And, it's heartening to note that Genova is coming up with an mRNA vaccine within India. And I hear there may be Pfizer coming into India soon. So those will be good for variants. And of course, we know that mRNA vaccines may also be good for children.
That's a very, very important point. And in fact, Dr. Dasgupta, that's a very significant point. Of course, the newer vaccines that come in, when that happens, of course, is an entirely different question. But the most important aspect also that many are concerned, especially when it comes to the third wave, is whether it could impact children more. There is, of course, I know there are trials that are currently underway at AIIMS in different parts of the country. But is that something that you would say is something that is a way to go, perhaps with the next 5 to 6 months? Is it possible that we would have those vaccines for children in place to be administered?
Well, 2 or 3 quick points on this. First, a number of experts have now come out, at least trying to make this point that there doesn't seem to be enough evidence that children would be disproportionately affected. First. Second, what would happen in terms of third wave, if and when, will be an outcome of what we learn from the district level sero surveys that the Niti Aayog has asked the ICMR to conduct. And only when those district level sero surveys results are available that A, we will know the extent of the vulnerability, and B, the extent to which children are already have the evidence of infection vis-a-vis adults. And finally, a third quick point, what he said about mRNA vaccines is absolutely correct, and therefore India has to be nimble-footed enough to not be stuck into a One India plan and have more decentralized vaccination strategies.
Well, Dr. Dasgupta, Dr. Soin, I'm sorry to interrupt you, but we're completely out of time on the Newshour this evening. A new variant of concern, Delta Plus. Is India equipped to handle it? Do we have the vaccines that can actually tackle it? Those are some very important questions, certainly, that all citizens are interested in knowing the answers for. Thanks so much for joining us on the Newshour this evening.
You were watching the News Hour at 9. Stay tuned.